Well, I want to thank Dr. Buchanan not only for inviting me to be here with you today. Did that help or hurt? About right. Hear me just fine? Good. So I want to thank him for inviting me to be here. I want to thank him for that introduction, and I want to tell him I was born in Clarksville, Texas. So I do know where New Boston, where Boston, Texas is. It's really a privilege and a pleasure for me to be with you tonight. Class of 2016. Proud parents, excited spouses and significant others, friends and other family, guests, distinguished guests, faculty and staff. It's my pleasure to be with you. I am particularly excited to congratulate you honorees upon reaching this privileged and highly prized stage in your professional life. As Dr. Buchanan has reminded you, there were many who would like to be seated here this evening, and you are the ones. You are the ones to be here tonight. You're the ones to take responsibility for our future. You're our future leaders, and you're the ones we're depending on. I tonight want to echo the sentiments that have already been expressed to you, but you can count on the fact that I plan to elaborate. As I see it, tonight's ceremony is both celebratory and symbolic. You honorees have experienced a rigorous course of study and preparation to be here tonight, and we celebrate that fact. We celebrate your hard work, and we celebrate the fact that you've earned the right to this initiation in one of society's most noble healing professions. But tonight, too, is symbolic. Your donning of the white coat represents the commencement of one of the most important undertakings as you become a doctor. Your undertaking to diagnose the patient's problem, to establish the treatment plan, and to perform irreversible surgical procedures on that person. The person fortunate enough to wear a white coat and be called doctor is in today's world a professional. As a professional, you inherit a mantle of respect earned by doctors over the ages, doctors who assumed the conduct of professionals. You now assume to build upon this legacy of those who went before you. You assume the responsibilities of a professional. So what do we mean by professional? Sir William Osler, one of the world's most influential physicians at the turn of the century, remarked, in his words I find appropriate tonight, "You, the professional, are in dentistry as a calling, not a business." Fast forwarding into today's world, I would tell you that professionalism demands first placing the interest of the patient above those of the doctor. It demands setting and maintaining standards of competence and integrity. And so importantly, professionalism is based on trust, that T that we've just heard mentioned. You must assume to ensure the public's trust in the dentist and the doctor. For that trust, we professionals are granted a respect unlike any granted to any other individual or group. That respect allows us to lay hands on another human being, and in so doing alter the quality and the quantity of that person's life. That trust allows us the opportunity to work in an autonomous fashion. And that trust allows us to regulate ourselves. We must never take these privileges for granted, for in spite of the significance and the power inherent in the white coat, dentistry always risks losing those privileges. In fact, I will admit tonight I have some worries regarding the profession's future. Commercialism and changes in healthcare delivery systems throughout the industrialized world threaten the values of professionalism. Such changes include the conversion of dental health care offices to dental spas, the delivery of surgical care by lesser trained individuals, the public's malaise with respect to the quality of their own health care, and the growing trend for dentists to overly push aesthetics while downplaying the prevention and treatment of disease. Such conditions in and around dentistry today are tempting doctors to abandon their commitment to professionalism and to the primacy of patient welfare. Doctors, do not forget, your ethics are your power. Your challenge today will be not only to learn the art and science of dentistry, but also to face these changes and challenges facing dentistry. Face them as professionals. Resist efforts to impose or allow a corporate mentality on a profession of service to others. Always do what is in the best interest of the patient. We must never forget that being a professional is a special privilege and a privilege that society grants to us public servants. In light of my concerns, let me share with you my vision of you, of the emerging professional. I would tell you that as you begin to treat patients, you will be faced with three important endeavors. Your actions will be the key to protecting the leader positions of the dentist. Your actions will be the key to protecting the doctor-patient relationship. And your actions will be the key to protecting the profession itself. It will be your responsibility to ensure that we dentists remain doctors in the full sense of the calling. Recently, one of our highly esteemed medical colleagues, Arnold Kasanoff, an internal medicine physician, bemoaned the loss of the doctor-patient relationship in his article entitled, "The Backbone of Healthcare is Crumbling." He further stated in that article, "Some think it's best for society to relinquish the days of Marcus Welby, MD." Now, as I look across this audience, I have to anticipate some of you may have heard your grandparents talk about Marcus Welby, MD. For those of you who might not be familiar with that name, Marcus Welby was a television doctor. He wore a white coat, and he was beloved by his patients because he always showed his caring and concern for them as individuals. So let me repeat. Some think it's best for society to relinquish the days of Marcus Welby and embrace the world of large, impersonal groups and computer-driven managed care. Hippocrates would disagree, and so do I. Yes, we enjoy technological advances, but as we use technology to the patient's benefit, we must not let the technology get between us and the patient. As you assume the cloak of this profession, the white coat, you therefore become charged not only with the primacy of patient care, but additionally with the stewardship of your profession. Yes, dentistry, the practice of dentistry, is assured a future. But will it be a profession, or will it be a business? A profession or a business? Your generation must face that question, and you will initiate the answer as you begin one-on-one relations with your peers, with your faculty, and very soon with your patients. I encourage you to commit to the life of a professional, as stated in the January 2009 issue of the Journal of the American Dental Association. Professional credibility is priceless. Professional credibility is priceless. In closing, I want to use the words from Alan Alda. I think most of you will remember the actor who played Surgeon Hawkeye Pierce on the television series MASH. You know, they continue to replay that, so surely most of you have seen MASH. Now, Alan Alda was asked to speak at a medical commencement fairly recently, and his words struck my heart, and I have used his words on multiple occasions since, and I want to offer these to you. He said, "Be skilled, be learned, be competent, be aware of the dignity of your calling, but please don't ever lose sight of your own simple humanity. You are entering a special place in society. People will defer to you, call you by your title, and it may be hard to remember that the word doctor is not actually your first name. I ask of you, possess your skills, but don't be possessed by them. Put people first. You can read my x-rays like a telegram, but can you read my involuntary muscles? Can you see the fear and uncertainty in my face? Will you be the kind of doctor who cares more about the case than the person? There is one more thing you can learn about the body that a non-doctor would tell you, and I hope you will always remember this. The head bone, that's our area of the body, the head bone is connected to the heart bone. And I would add that the heart bone is connected to the soul. Doctors, don't let them come apart. I assure you that if you adopt these traits, your greatest reward throughout your career will be that of having become a professional, of having been afforded the opportunity to serve your fellow man, for no greater opportunity, responsibility, or obligation can fall to the lot of a human being than to be a doctor. Congratulations, doctors. I wish you all the best as you go forward. I look forward to my affiliations with you in the future as you become active in the profession and hopefully in organized industry. And I hope that as you go forward, you make your choices on behalf of the patient and the profession. Thank you very much, and the very best of luck to you.